Hi, everybody. I'm Malcolm Butler. I'm a family physician at Columbia Valley Community Health. I'm also the health officer for Chelan and Douglas County, and I appreciate you taking the time with me. I am, in theory, out of clinic this week, so I'm here at home. We'll keep this fairly short today. So things are bad right now. Things are worse than they have ever been. Our case count is up to 836 per 100,000 per 14 days. We have, I believe, 21 COVID patients at Central Washington Hospital. And we have another problem, which is that we have enough outbreaks in long-term care facilities now that they are not receiving new patients from the hospital. So a lot of patients don't need to be in the hospital, but they aren't quite well enough to go home yet. Perhaps they don't have good support at home, or perhaps they just need some more rehabilitation time. And usually those folks will be discharged from the hospital to a rehab facility or to a nursing home. And the problem is, if the nursing homes aren't able to receive new patients from the hospital, perhaps because that nursing home or long-term care facility has a COVID outbreak, that means that even though patients might be ready to leave the hospital, there's nowhere for them to go. And then the hospitals start filling up, not only with people coming in the front door, but because there isn't any way for people to leave, even though they don't really need to be there any longer. So we have some concerns right now about the status of the hospital. As you all know, we're all quite concerned about the Thanksgiving holiday. We did have a public testing at the Wenatchee High School last weekend. We tested over 1,500 people, so thank you all for coming out, those who did. I've not seen any of those results yet. Really what I want us all to be thinking about, as we've spoken about before, is hunkering down and staying home over the holidays. It's a difficult decision. I know a lot of people are concerned about how they might explain that to their families. It feels very difficult to say no when our family is encouraging us to come join them. And this is a year when we're all going to do Thanksgiving a little differently. It's going to be Thanksgiving at home, just with our family or our bubble, and then maybe meeting with family afterwards to go out for a walk or something like that. If you must meet at home, if you just think you have to get together, there's no huggies, wear your mask as much as you can, don't share the food, no double dipping, all the stuff that you're probably aware of. And certainly if you have anybody who's medically frail or elderly, I'd encourage you not to get close to them. So do the best you can with it, and we'll see you on the far side. Got a couple of questions that you all sent in, so let me pull those up now. Okay, so here are the questions that I got for this week. The first one is, the health district reported 6 deaths last week. Should we be worried about a death spike, or were these deaths over a span of a given time frame? So the deaths that were reported last week were spread out between the 6th of October and the 17th of October. The youngest individual was 66, the eldest was 81. So, all of them happened within 11 days. And I don't know if that's your definition of a spike in deaths. I think we have seen an exponential increase in the number of COVID cases in our community over the last several weeks. And we know that typically it takes about 5 days of incubation. People usually start showing symptoms around 3 to 5 days. When people get sick enough that they need the hospital, the average number of days to admission is about 10 days after the symptoms begin. And then deaths, if people are in the hospital and they get ill enough that they actually pass away, typically we see that at around 2 or 3 weeks after symptoms begin. So there's a 2 or 3 week lag time between when we first start seeing the incidence rate going up and when we see the deaths going up. And so I anticipate that, over the next month, we're going to continue to see increasing number of deaths. And I'm sorry to have to tell you that. But it just goes with COVID. We all know this. This is not mysterious to anybody. And it's just so widespread now that for sure we're going to see more deaths. Um, the second question, my employer is not requiring temperature checks. I'm afraid of retaliation if I report it to Labor and Industries. What do you recommend I do? Yeah, so all employers, as best we can, are trying to identify COVID as it's walking in the door at the beginning of the shift so that we can keep it out. And I think all of you are aware that if you are symptomatic, if you have a fever, the expectation is that you would call out sick from work, notify work that you're symptomatic and you're staying at home, and that what we check at the door is really just the last means of defense as people are walking onto a shift at work. I actually don't think the temperature check is very important. It's technically difficult to do. Most of us know if we are feverish anyway, we can feel it. So actually at my clinic, we don't check temperatures routinely on everybody. We do ask the question, are you feeling sick? Have you had a fever? Do you have muscle aches? Those sorts of things. So I think as long as the rest of the questions are being asked at work, I don't think you need to worry too much about temperature checks. And so I don't think you need to report anything. Okay, the third question, and this is a little bit what I was talking about before. My family still believes COVID is a hoax. They plan to gather for the holidays regardless of public health advice. I feel pressured to attend and I cannot wear masks around my family because they make fun of me. How else can I limit my exposure this holiday season? And that's probably a question a lot of us are sort of coping with right now. And that is a very difficult situation. I think the best thing that you can do is just be honest with your family. I think you need to say something like, you all may not agree with me, but I'm very worried about COVID this year and I cannot join you. I think you say, I love you all, and I hope that you'll appreciate that when I say I can't join you, it's because I'm worried about you and I want to keep you safe. And again, maybe propose that after dinner you get together and go out for a walk and you can, spread out and you're outside in the fresh air and hopefully that lowers your risk as much as possible. The other thing though, remember when we're having difficult discussions like that, we have to use what are called I statements. I feel this, I feel that. So we need to say things like, I feel worried, or I am unable to do this. I don't want you to say something like, when you say things like that, you make me feel bad. That's a you statement. You make me feel bad. You need to say something like, when you say things like that, I feel bad. Or, I hear you saying that and I feel guilty. So when you use the I statement, your family members, if you say, you make me feel this way, they'll say, no, I don't. But if you say, when you say that, I feel a certain way, they can't say, no, you don't, because you're using these I statements. So you can say, I am worried, I am concerned, this is super hard for me, but I am going to stay home. And you just have to be ready to have that discussion. And it's not wrong and it's not bad, it's just difficult. So great question, thank you. It looks like those are the three questions for today. So again, I appreciate the time you've spent with us today, and hopefully we'll all be together next week. We'll do it again. Thanks.